Thank you all so much for everyone who is online. We'll get started because we've got two great presenters that I want to make sure have time to talk. So I'd like to start by acknowledging that I'm presenting this webinar from the lands of the Kaurna people and pay my respects to elders past and present. Rob, do you know what lands you're on? Oh, you've got it in your thing, so thank you. So I'd like to particularly acknowledge someone who was never seated and that been hearing for a lot of Aboriginal people that it's a difficult time at the moment post-referendum for a lot of people that were hoping for a better outcome than what we got. And that's obviously central to the topic today of health equity. So today we have two fantastic presenters, Dr. Joanne Flavel from Australian Health Equity and Robert Sturrock from ACOS. So we'll hear from Jo first, and then I'll introduce Robert, and then we'll have time at the end for Q&A that you can put in the Q&A section of Zoom if you want to enter in questions as they go along, and then we'll get to those at the end. So I'll start with introducing Jo. I've had the real pleasure of working with Dr. Joanne Flavel for a couple of years now. She's a research fellow at Australian Health Equity. She's got qualifications and lots of experience in economics and public health, and great expertise in quantitative analysis that we've found invaluable in a range of different projects. She leads all of our social epidemiology and Charlie Mark Humphreys, their social epidemiology work at Australian Health Equity. She's a collaborator on the global burden of disease, and she's actively involved in the Public Health Association of Australia and the Australian Health Promotion Association. So Jo, when you're ready, please share your slides and we'll get going.
Thanks for that kind introduction, Toby. I'll just get my slideshow started. So hello everybody, it's really nice to be speaking with you all today. I'm going to be speaking about the Restore the Fair Go social epidemiology work that I've been working on for a little while now. I'd like to begin by acknowledging the Restoring the Fair Go team, Fran Baum, Toby Freeman, Connie Mussolino and Julia Renath, and also like to acknowledge that this research has been funded by Fran's NHMRC Investigator Fellowship entitled Restoring the Fair Go. I'd also like to acknowledge that this presentation is given on the lands of the Kaurna people and pay my respects to their elders past and present. I acknowledge that sovereignty of this country was never ceded, it always was and always will be Aboriginal land. So a bit of context, while there has been overall progress in health outcomes, including increasing life expectancy and decreasing premature mortality, health inequities are increasing in many countries, including Australia. The Australian Institute of Health and Welfare publication on Australia's health has repeatedly noted there are data and analysis gaps in Australia for monitoring social determinants and impacts on health equity. Inequalities are effectively invisible if they are not measured. Understanding of inequalities in health depends on the availability and analysis of data. Analysis alone does not lead to policies designed to reduce health inequities, but evidence, and especially accumulation of compelling evidence, can be used by civil society and policy advocates to build political will. And here's some background on our work. The Restoring the Fair Go social epidemiology analysis builds on a number of smaller projects that our teams worked on since 2018. This began with our SA Heaps Unfair project. There's some small projects on health and social inequalities in Australia and on regional inequalities in health and social terms of health. And all of these projects found increasing inequities. The Restoring the Fair Go analysis is much more comprehensive than analysis in the smaller projects. It draws on many more sources of data. We've analysed data from the late 1980s where available until the most recently available for 2022 or 2023 where we could get this. We conducted descriptive analysis of publicly available data and published reports. So the first part of the analysis was a comprehensive health profile. The profile examines the nature of health inequities, the trend and extent of health inequities in Australia, and this includes during the COVID pandemic. Data sources are used for analysis for the Public Health Information Development Unit data, data from the ABS and data from the IHW, and some data from gender and health inequities analysis that I also conducted. Public Health Information Development Unit latest time series release had data for 2016 to 2020 and for an earlier time point for many health measures, including median age of death, premature mortality, avoidable mortality, and infant mortality. There's also a new, relatively new IHW burden of disease study for 2022, which was good timing for us, as that's only updated every 3 to 4 years. And we also drew on ABS COVID-19 mortality data as of February 2023, so that's reasonably current. And like I mentioned before, referring to published reports. Headline measures of overall health, such as life expectancy, mask differences in health by socioeconomic status and by multidimensional factors like income, gender, and migration status. Health inequalities have increased for median age of death and by premature mortality and avoidable mortality, and it's particularly evident for avoidable mortality. Inequality in percentage of deaths due to COVID by socioeconomic disadvantage is really evident, and also by region of birth. There's a clear social gradient in health measures of mortality and for self-assessed health, and for leading chronic diseases that are contributing to the non-fatal burden of disease. Mortality and morbidity increase with increasing socioeconomic disadvantage. There have been reductions in mortality for every quintile, but the largest declines in premature and avoidable mortality were for the least disadvantaged quintile. I'll have more on that in a minute. The difference in the extent of decline in mortality by socioeconomic disadvantage has led to a steeper social gradient. So this figure illustrates this for avoidable mortality. This is average age standardised rate of avoidable mortality per 100,000 people in Australia in 1997 to 2000 and 2016 to 2020 by quintile of socioeconomic disadvantage. So each of the bars is 20% of the population. The dark blue is the most disadvantaged quintile going through to the light blue, which is the least disadvantaged quintile. You can see that the data on the right, the bars are smaller for 2016 to 2020, and they show how avoidable mortality has decreased, but the social gradient is visibly steeper in 2016 to 2020. And this is why. This is the reduction in avoidable mortality by quintile between 1997 to 2000 and 2016 to 2020. So there was a much larger decrease in avoidable mortality for people living in the least disadvantaged socioeconomic areas, which has increased inequality. The reduction in avoidable mortality for the least disadvantaged quintile was 42% overall, and the amount by which it decreased with increasing disadvantage. There isn't a lot of difference between quintile 5 and quintile 4, and even the drop to quintile 3 is not that much, but there's a big difference for quintiles 4 and 5. And the reduction for the most disadvantaged quintile was less than half the reduction for the least disadvantaged quintile. This figure has percentage of deaths from COVID by quintile of socioeconomic area disadvantage, that's February data I mentioned. The high number of overall deaths with increasing disadvantage is evident for males and females on the table. The percentage of deaths from COVID increases with increasing disadvantage as well. And there's a social gradient you can see in those percentages too. More than 30% of deaths for men and women in the most disadvantaged quintile were from COVID, and a much lower percent of deaths were from COVID for the least disadvantaged. But you can see it increases with increasing disadvantage again. Moving on to the social inequities now. The second part of the analysis was analysis of patterns and trends in the distribution of key social determinants of health, income, wealth, housing, education, employment, and social inclusion. Data sources for analysis of social determinants also include the Public Health Information Development Unit and the Australian Bureau of Statistics, but I drew more heavily on data from published reports for this analysis, including by ACOS, by per capita, and the IHW and others. Recently published reports contain rich evidence on social inequities, and referring to the findings from these reports allowed a more detailed analysis than would otherwise be possible. Looking at income, current income inequality is much higher than it was in the 1980s. It particularly grew during the boom from 2000 to 2008 and hasn't improved since. The top 20% received 6 times the annual household disposable income that the bottom 20% got in 2021, according to the Actuaries Institute. The share of national income held by the top 1% and top 10% actually declined during the 1960s and 1970s, but we had some reductions in inequality, and began rising again in the 1980s. The share of the top 10% grew from just under 25% in 1980 to 35% in 2009. The share of the top 1% increased from 5% in 1983 to more than 10% in the early 2010s. We do know how to reduce income inequality. Income inequality fell to the lowest level in 20 years in 2020, primarily due to the temporary increase in job seeker. Income inequality increased again to pre-pandemic levels in 2021 when these supports were withdrawn. We did conduct analysis by jurisdiction, which indicates that New South Wales and WA have higher relative income inequality and that ACT and Tasmania have lower income inequality. Analysis of mean disposable household weekly income by quintile found Tasmania and South Australia have a higher share of their populations on low incomes, and ACT, New South Wales and WA have a higher share on high incomes. But obviously we have to keep in mind cost of living is different in different states. The Actuary Institute report emphasises the multidimensional nature of inequality, that there are income gaps by gender, country of birth, by disability, and for Aboriginal and Torres Strait Islander people. This figure has percentage of individuals reporting fair or poor self-assessed health by household income quintile. It was produced using microdata from the ABS survey of income and housing for 2019-20. And you can see the really steep gradient. It's even more evident in individual data than it was in the area data that I showed. And a comparable figure for self-assessed health is just more pronounced with individual data, which others have found as well. So the highest income quintile has only 7% of people in fair or poor health, and the second highest is only 8.8%, so that's quintile 4 and 5 there. And then the lowest income quintile has 26.8%, and there's 21% in the next lowest income quintile, so big differences. This figure has a changing share of wages and profits, the share of GDP from 1974 to 2019, from the Actuaries Institute report as well. The wages share has declined over this period and is currently at a near all-time low. I know this is related to employment, but it's also related to income. So here, the share of income going to profits has reached an all-time high cut-off level. It's really bad. And this trend has coincided with a period of growing income inequality, particularly since the 1980s. Looking at wealth, the OECD framework for wellbeing uses average wealth, which is a terrible measure to use. Australia ranks highly for this, but it masks wealth inequities. It tells us very little about the distribution of wealth and is inflated by rising house prices, which continue to rise really strongly in Australia. Inequality in wealth is much higher than inequality in income. According to the Wealth Inequality Database, the bottom 50% of Australian population held only 5% of total wealth in 2021. The top 10% held 57% and the top 1% held 24%. ABS income and wealth statistics estimate that in 2019-20, the bottom 20% only held 0.7% of wealth, compared with 62.8% of the top 20%. There was a sharp increase in wealth inequality between 2003-04 and 2018-19 due to much higher growth in wealth for the already very wealthy. ACOS estimates suggest that the wealth of the top 1% increased over this period after inflation by an average of 84%. The wealth of the top 10% increased by 65%, while the wealth of the bottom 60% rose by only 20%. And if we looked at the bottom 20%, I'm sure it would be much lower again. ABS statistics estimate that the lowest 20% had average wealth of 35,000, compared with overall average of 1 million and an average of 3.27 million for the highest quintile. There's multidimensional inequality in wealth as well, with the Actuaries Institute finding higher shares of Aboriginal and Torres Strait Islander people, people with a disability and working age unemployed in the lowest household wealth quintile. So this figure shows some of those numbers that I mentioned before, the ABS statistics on share of net worth by quintile of equivalent disposable income. So you can see that high wealth inequality in 2019-20, 0.7% for the lowest 20%, 4.8% for the second lowest quintile. It's actually not that high for any of the quintiles except for the highest income quintile, which has almost 2/3. Moving on to housing now, average house prices grew much faster than average wages and earnings after the introduction of the capital gains tax discount in 1999, and I'm drawing on some work from per capita here. House prices rose from 2.5 times annual household income in the 1990s to more than 6 times annual household income in 2020. The Demographia International Housing Affordability Reports already ranked house prices in Australia as extremely unaffordable from the early 1990s onwards. The further increase in house prices in the last 3 decades have put home ownership out of reach for people on lower incomes. In 1996, almost 330,000 occupied dwellings in Australia were public housing. The stock of public housing declined dramatically between 1996 and 2021 with the number of occupied public housing dwellings falling to less than 278,000 in 2021, so it's a loss of more than 50,000 dwellings. Other types of social housing did grow in this period, but not by enough to make up the decline in public housing. Social housing grew 4% between 1996 and 2016, but the number of households grew by 30%. Two reports have estimated the number of new social housing properties that will be needed by 2036 and have suggested we will require 36,000 new social housing dwellings every year from 2016 to 2036, and we're not building anywhere near that many. The slow growth in social housing has pushed many more low-income households onto the private rental market. Housing costs are a much higher percentage of disposable income for those in the lowest income quintile, and median house prices rose by 31% the first 2 years of the pandemic, and rents rose by a third in most of Australia. 54% of households on low incomes were in housing stress in 2017-18, which is 30% of the disposable income spent on rent, and that will be much higher now. This figure has housing costs as a percent of the disposable income from 1994-95 to 2017-18, and this is from the Capita's Housing Affordability Report as well. Housing costs as a percentage of disposable household income are lowest for the highest income quintile, which is the light green line at the bottom, that remained around 10% for the entire period. Housing costs increased by about 2 to 3% for the fourth quintile in orange, the third quintile in blue, and the second income quintile in yellow, but they increased the most for the lowest income quintile in purple, the people who could least afford it. It rose from 22% in 1994-95 to 29% in 2017-18. And this increase in housing costs has coincided with a decrease in social housing, public housing, increase in the size of the private rental sector. And that 29% is dangerously close to housing stress of 30% and would be much higher again now. Now, this figure has a distribution of capital gains tax discount effects by household income decile, again from per capita. Each of these is 10% of households of these bars, the lowest income on the left and highest on the right. You can see almost 3/4 of the benefits from the capital gains tax discount go to the top 10% of earners with the highest incomes, and almost 82% go to the top 20% of income earners. These people are already quite wealthy. The distribution of benefits from the capital gains tax discount clearly shows the role of this policy in contributing to housing inequality and perpetuating wealth inequality. The combination of the capital gains tax discount and negative gearing has distributed housing wealth away from younger people to older people and to the already relatively more wealthy. And I do want to point out, you would have seen over these slides, it's not just a problem of the bottom 20%, it's also that top 20%. We need action to lift the bottom, but also to do something about the inequities at the top if we want to do something about flattening the social gradient. Looking at education, educational equality is also high and worsening despite more than 3 decades of national goals for schooling related to equity in education and social justice. A Guardian article recently reported that growth in per student funding for private schools has been double that of public schools in the past decade. And public schools have lower average socio-economic status enrolment, so you can imagine the impact of that. Gaps in schooling achievement exist by socio-economic status across all skills and all levels of schooling, from early years to post-school, and I'll talk about this more on the next slide. Median scores in reading, maths and science fell between 2000 and 2015, and inequality in science scores and reading scores increased. There is some positive news. I know I haven't had much during this presentation. Full-time participation in secondary school at age 15 increased between 1986 and 2021, and socioeconomic inequality in this measure did decrease. Education inequality is also multidimensional by socioeconomic status, geographical location, Indigenous status. Higher rates of participation in vocational education and training in more disadvantaged socioeconomic areas suggest that vocational education and training offers a more accessible path to qualifications compared with higher education. The proportion of school leavers participating in higher education increased nationally between 2000 and 2021 for all quintiles, but the decrease was lowest in the most disadvantaged quintile, and inequality has increased. This figure has measures of learning by socioeconomic status from early years to adulthood from Lamb et al.'s Educational Opportunity in Australia report. There are gaps by socioeconomic status across all development domains, all skills and all levels of schooling and into adulthood. The gaps are even larger in middle years for mathematics, science and reading achievement in senior years, and for both measures of learning in young adulthood. Students who are behind when they start their learning often stay behind. Educational inequality in these results is at odds with the national goals for schooling related to equity and social justice. Looking at employment, unemployment has decreased over the past 3 decades, and in 2022 was the lowest it had been in many decades. Underemployment increased over the same period that unemployment decreased, and more than 800,000 workers were underemployed, in Australia in 2022. That has decreased, but it is still quite a substantial number. Overall labour force participation rate has increased, and this has been driven by increasing labour force participation for women. The social gradient in labour force participation is pretty evident as well. Labour force participation rate is lower with increasing disadvantage, and social gradient is actually higher for female labour force participation. Employment grew more strongly than population growth over the past 3 decades, but has been distributed unevenly. There's differences in unemployment and labour force participation for some groups, unemployment being higher for people with lower education, recent migrants, and Aboriginal and Torres Strait Islander people, but the gap in non-Indigenous to Indigenous unemployment has improved, and the employment rate has increased for Aboriginal and Torres Strait Islander people, so there's some positive signs there. Full-time employment decreased in the past 3 decades for both men and women, and part-time employment increased for men and women, most noticeably for men who didn't have much casual employment at all before. Part-time employment, sorry. Casual employment also grew strongly in the 1980s and 1990s, and currently 25% of women are employed as casuals and 20% of men. Higher skilled and better paying occupations have a much lower prevalence of casual employment. Reductions in percentage share of jobs requiring a lower level of education between 1996 and 2021 for both men and women likely contributed to socio-economic inequality in the distribution of employment. Underemployment was highest for occupations that do not generally require higher education and are already lower paying jobs. I only have a few slides left. I'm probably running over time. Sorry about that. Rates of labour force participation by quintile of socio-economic disadvantage in this figure from 1986 and 2021. It's Public Health Information Development Unit statistics. The labour force participation rate increased in every quintile between 1986 and 2021, but there's a clear social gradient where you can see labour force participation rate is lower with increasing disadvantage in both time periods. The degree to which labour force participation increased differed by quintile, which you can see in the figure. There's only very small increases in labour force participation in quintiles 1 and 2, those more disadvantaged ones. This figure has ABS data on paid leave entitlements by lower and higher paid workers in August 2022. The ABS definition of casual employment is a lack of leave entitlements. You can see casual employees are concentrated among the lowest income earners. Around 80% of the lowest 10% of earners are casuals, and almost 60% of the lowest 25%. The last social determinant here is social inclusion or social exclusion. I found 2 measures of the prevalence of social exclusion. The Social Exclusion Monitor estimates that 25% of Australians experience social exclusion, and this is similar to the Inclusive Australia Social Inclusion Index estimate of 6.7 million Australians, which is approximately 25%. The number of people experiencing homelessness, real social exclusion, increased between 2006 and 2021. Rising housing affordability stress has led to an increase in the percentage seeking homelessness service due to housing affordability stress. Data on the percentage of dwellings where internet was accessed by quintile of socio-economic disadvantage indicates there was a decrease in socio-economic inequality in internet access between 2006 and 2016, but substantial inequality remained. And according to the Australian Digital Inclusion Index, digital inclusion increased overall between 2014 and 2020, but our analysis has found there's a social gradient in digital inclusion for every measure in the Australian Digital Inclusion Index for access, affordability, and digital ability, and digital inclusion decreases with lower income. So letting you all know what the next steps are. I've finished the draft of a comprehensive social epidemiology analysis with key findings, and I'm now working with the research team on an interim report for Restoring a Fair Go, where you'll find all of the reports and things that I've referred to here cited. The next steps in the research program is qualitative interviews for policy actors. The interim report will be provided to policy actors prior to semi-structured interviews, and a revised report will be made available prior to World Cafe workshops, which will refine recommendations. Key findings from this report will inform responses from policy actors and interviews, but input from the interviews will also inform revisions to analysis. Our research team is currently forming a Health Equity Learning Lab Oz with members from key NGOs, and a comprehensive social epidemiology analysis and reports intended to provide compelling evidence on inequities in health and social determinants and interactions between these. but we need to and will work with civil society to advocate for more equitable public policy through our trial of hello. And it's my last slide. I just want to thank you all for listening to me. And I have my email here and also my Twitter handle if you'd like to get in touch with me after the webinar.
Thank you so much, Jo. That was a really powerful, confronting presentation of some dire statistics and all of the issues driving those statistics. Before we open up to questions, I'd like to introduce Robert Sturrock, who is a Senior Advisor on Community Services at the Australian Council of Social Service, ACOS. And Rob leads the community services work there, including leading the research and policy advocacy with the federal government to strengthen community sector policy. And I know I've admired ACOS's strong advocacy on equity for quite a long time. So Rob has been involved in public policy development, advocacy and research at various levels of government. And I invite you, Rob, now to do a response to Jo's presentation. So thank you.
Thanks, Toby. Thanks, Joanne. Really appreciate that presentation. Thank you, one and all, for joining this webinar. I really appreciate it because I'm sure like many of you, it's a pretty manic time of year. So I appreciate you taking the time to join. As Toby said, so I'm the Program Director for Community Services at ACOS. Hopefully you've got a broad familiarity with ACOS, the Australian Council of Social Service. We're the national peak body for the community services sector, but we do a lot of research and advocacy around poverty, inequality, disadvantage. We do a lot of liaison with the federal government. There are state and territory councils of social service as well that do it with their respective governments as well. So a lot of what Joanne has gone through, really resonates with me, really resonates with ACOS and our membership, because we're sort of seeing and living those issues in many ways every day. I'd also like to say at the outset, I think it's really great to have these types of webinars where you're connecting academia with the community sector or policy work. I think that's really important in terms of making an impact in the policy debate. One of the things I'll talk about a bit later is, the challenges we have at the moment in persuading the federal government to take more sort of substantive, bolder action to tackle a lot of the issues that Joanne went through. So, I think it's really important that you sort of different coalitions and allies can come together, because I think that way sort of our actions, our research and advocacy is way more persuasive for government. It's harder to ignore really if we're coming together. So look, I thought in my remarks, I'll give you a sense of what we as ACOS and our membership has seen on the ground in terms of the reality of those statistics, and then talk through some of the advocacy work and the activity that we've been doing at the federal level and some of the challenges we see in tackling things like the yawning gaps around wealth inequality, the need to do stuff about, how much wealth the wealthiest quintile are retaining versus the lowest quintile, and those connected issues, because this is one of the big challenges we have, is getting the government to act systemically, sort of across portfolios, not to do things in a siloed manner. Some of you also might be aware that ACOS, along with the UNSW, have a poverty and inequality partnership. We're doing a lot of research over the last several years around the levels and extent of poverty and inequality in Australia. I thought maybe I'd start with just some sort of complementing what Joanne said, some statistics around poverty, because that's really sort of the bread and butter of what ACOS does. So at the moment, the best reckoning we have from the data is there's about 3.3 million people in poverty, which includes about 761,000 children. I think that's a statistic that not a lot of people generally have wrapped their heads around in this country. I think there's an ally space, and there are people who are working in this area that I think are very familiar with this. I think the general public, the sense that maybe 1 in 6 children are in poverty, or we're looking at 1 in 8 adults, I think that's quite a surprising figure still for a lot of people. I think that shows the level of persuasion, level of communication still required to really bring up that sort of general level of understanding about just how deep and entrenched some of these social problems are. From our best reckoning, working with researchers, the poverty line in Australia in a realistic sense is about $489 a week for a single adult, and about $1,000, just over $1,000 a week for a couple with 2 children. And that includes everything, right? That's covering everything: rent, bills, groceries, medicine, things for kids. It's an incredibly anemic rate. And I think we're seeing very distressing stories come through, either through our membership or through our grassroots network, which is a group of people that are experiencing poverty right now that rely on income support. The sorts of stories we've seen have just been getting increasingly dire over the last several years, and they're really at a breaking point right now. What is also really frustrating, and Joanne flagged this, I think, in her presentation, is that we had a glimpse of doing things quite differently during COVID. Joanne talked about the COVID statistics, but at one point when the COVID supplement was brought in about sort of mid 2020, we saw some quite sharp declines in the rate of poverty. So about 646,000 people moved out of poverty in about mid 2020 because we raised the level of income support. So New Start went to JobSeeker. JobSeeker was at a higher level, and we had the COVID supplement. So we actually saw the quite deep inroads in the levels of poverty, but as you would all be aware of, we rolled those back, and the previous government rolled those back. And there's been some sort of incremental efforts by the current federal government to raise income support. So a whole lot of people that were out of poverty are now back into it. And we're sort of back to the same policy battle that we were having, 3, 4, 5 years ago. Obviously, there's a lot of discussion too at the moment around cost of living and cost of living pressures, and it's being felt across the community. From our best research too, about 7% of people whose main income is actually wages are in poverty. And overall, in terms of the people in poverty in total, they represent about 38%. And that's something else that's coming through our membership quite strongly at the moment, is people presenting to services for emergency and financial relief for the very first time. They're coming through in quite high numbers, and a lot of them have some form of paid work, which shows you just, I think, how biting it is. To Joanne's point too, there's a lot of research, not just from ACOS, but from yourselves online and across the academia sector in Australia around the health and emotional and physical impacts of poverty. We've been trying to make this point to various levels of the public service and the ministers in the government for a long time, and that it's the sort of flow-on effects that high and sustained levels of poverty have across the other areas of the government. So, I'm sure you're all aware of, the links to severe mental and emotional health, the physical health deterioration, the need to sacrifice getting the support necessary because you just don't have the resources and the means to do so. And also getting back to something that Joanne was mentioning in the slides, that intergenerational effect, that people become trapped in this cycle because we've sort of made our social security systems and our support systems so targeted and sort of so narrow that we're seeing this intergenerational cycle continue to play out, which is an incredible sort of travesty, really, for a country as wealthy as Joanne says, as wealthy as Australia. We're about the 4th wealthiest country in the world. These are all problems that are within our grasp to solve if we have the right priorities and that political willpower to do so. I thought it might also be interesting, and obviously Toby and Joanne, do let me know how I'm going with time. I don't want to chew up too much time. The perspective from community services and what they're seeing. So I've talked to you there about sort of the context of poverty. I thought it might be interesting because, again, for the sake of sort of intersectionality, to see how that's flowing through to community services. So every year until recently, ACOS, we do what we call the Australian Community Sector Survey. It's a national survey. It's the only one of its kind in the country, and it gives us a really good cross-section of what the community sector are seeing on the grounds in terms of community demand for services, what it's like running a community service organisation at this point in time, levels of poverty, etc. We had a really good, robust sample for the last survey, which we did was late last year. And basically across the board and all the different types of services that comprise community sector, members are seeing high levels of poverty increase, the complexity of people's needs, the number of sort of personal challenges they're requesting assistance on it's becoming more complex and more intense. The demand for services across the board has sharply increased. And this is particularly the case around, this won't become as a surprise, I'm sure, around housing and homelessness services, family and domestic violence services, and mental health services. So again, I think you really see that reflects what Joanne's already spoken about, but they're the areas of the community sector where we're seeing the most acute demand, and where providers are saying they're seeing the highest levels of poverty, the highest levels of complex need. And from the provider's end, the higher responses of an inability to fully meet the community demand, which is a really important part of this story. I think, you have what's happening in the community. We've got those sort of sort of moribund social policies that Joanne mentioned, but for the community services sector, they've probably never felt as overwhelmed as they have now. And that's taking into account the years of COVID, the bushfires in 2019, 2020, the couple of years of floods. There's a real sense of being just overwhelmed by the level of demand and the complexity of the problems in the sector. Obviously, us, our members and others are going to government and trying to make this case very stridently, particularly from the angle of the need to do stuff around income support and housing, as well as investing in essential community services. That message is, I say, acknowledged by the federal government, but the action part is still where we've got the most problems, I think. I think sort of my last point, because I'm just conscious of time, is this challenge that we have, I think, in the social policy space, whether it's academia or sort of advocates like ACOS, in getting the government, the federal government, is to act systemically. Now, this is a point that Joanne made. There's a really strong and clear and compelling case when you look at the evidence, like in Joanne's presentation, for the need to do way more on tax, to look at where the wealth is allocated within our country and to work out a better way to maybe redistribute that wealth or tap into sort of untaxed wealth like there is in superannuation to fund some of the essential priorities and services that we need in the rest of the community. This government's been in power for about 18 months, about halfway through their first term now. They've initiated in that 18 months a lot of reviews, a lot of consultations, a lot of examinations of the way our systems work. They've started to get recommendations in some pretty key areas, like you would have seen there was the Robo-Debt Royal Commission report, which had a suite of recommendations about how you engage as a Services Australia with people that rely on income support and government assistance. There's the Disability Royal Commission as well. The NDIS review is about to land. There's going to be these major systemic pieces of work that are going to have sort of wanting rigorous reform from the government. The key question is, does the government really have the heart to do this forthrightly and to really substantively undertake the reform that's required? In the community services space, there's been sort of siloed reviews going on that are looking at sort of community care workforce, what they would call the care and support economy, the community sector specifically, and they're all sort of running on parallel tracks, but there's not really that connection across the government. They're not seeing how, for instance, the taxation and the macroeconomic policy influences their industrial relations and employment policy, which influences the workforce and the investment in essential care services. It's all sort of happening in sort of a piecemeal way, which is quite frustrating, because what we are trying to advocate to the government for is the need to see these issues as connected the way that Joanne presented them, to see that wealth inequality or social policy inequality, or even as Joanne was saying, sort of where we are at education, where a person's background is having a far greater influence on their educational achievements and outcomes than it should. We're trying to advocate to tackle it holistically. I literally just finished a submission to the federal government last week, which was looking at setting up, well, one of the recommendations was to set up sort of a cross-sector, cross-government policy unit within Prime Minister and Cabinet. So things like even investing in community services, which is so critical at the moment, could be done in a coordinated way, rather than Department of Social Services and the National Indigenous Australians Agency and Health and Aged Care all doing different things, to do it in a coordinated way. And I think that's something that is still missing, is that systemic reform. I think for my very final remark, and Joanne did mention this as well, the need to do sort of the big systems thinking work is very critical when it comes to income support and housing. Joanne had those statistics around the decline in the social housing stock. I mean, we are paying an enormous penalty right now for the fact that we do not have enough social housing. In some states, the wait lists run to 10 years plus. We have replete of stories, either from people directly in the community or providers, about people who are permanently sleeping in tents, permanently living in their cars, moving between locations to try and find someone that they can sort of couch surf with. These stories are increasingly prevalent. And we know from our engagement with different sides of the parliament that the politicians are noticing that as well in their local communities. It's heartbreaking. It just shouldn't be happening, but it's because we've got this long-term decline in the social housing stock. And while there is housing policy, there's the Housing Australia Future Fund, and there's an acceleration at the national level, it probably is insufficient in terms of the number of properties they're going to seek to build in the next 5 to 10 years. And the other one, obviously, is income support. If you've heard of ACOS, you've most likely heard of us through the Raise the Rate campaign, which has been running for several years now. There was some steps forward in the federal budget in May this year, where levels of income support did go up after a very concerted public campaign that included Labor backbenchers signing on for supporting raising income support. But it wasn't at a rate that is that we were calling for. We're calling for at least $76 a day, and it's still significantly below that. And the government, you might have seen, has a lot of programs and commitments around place-based work. Jim Chalmers will talk a lot about entrenched disadvantage and tackling entrenched disadvantage. And they're very smitten with the idea of you do locally place-based work where you connect services together and you have case management systems that can help people over a long period of time. And as important as that is, it just will not have the same impact as if you systemically raise income support levels and build more social housing. You'll instantly not instantly, but you'll very quickly take the pressure off the community services sector, because people will be getting shelter and enough money to then sort of be able to afford the essentials of life and to rebuild their lives. And no amount of locally well-intentioned place-based work can sort of compensate for those big major systems reforms. We're expecting a federal budget next year that will be quite tight again in terms of its spending. That's kind of the rhetoric that's already coming from the government. The mid-year economic forecast will be coming out early next month, and we would expect the government's going to be framing that in terms of times are tight, we can't spend, we need to tackle inflation, etc. So they're going to be trying to sort of rein in expectations around sort of spending and investment. But for all the reasons that you saw in Joanne's slides, and we need this investment in our social policy and our social infrastructure, because otherwise we're going to continue to see those levels of wealth and income inequality and poverty either stagnate or get far worse. And then we start looking like places like America, which I don't think anyone wants. Look, maybe I'll stop there. Again, thanks for your time, and yeah, really good to be here.
Oh, thank you so much for all of those reflections, Robert. That was really, really valuable, and reflects a deep kind of experience and expertise on this topic, and probably hasn't improved the mood of gloom around the statistics, because, as you say, it's hard to see what action is being taken when we have all of this knowledge. So thank you both so much for incredible presentations. We've got some time left, a quarter of an hour left for Q&A. So please do add further questions to the chat that you've got. Jo, you've indicated that you'd like to answer Gemma's question live about, is there any way to obtain a copy of them?
I'm very happy for attendees to have a copy of my slides. And I do have the reference list in the draft report, so I can come together, I can get a quick bibliography together so that people will know how to access the different reports I've referred to.
One thing sorry, Toby, just you said it was all doom and gloom. One thing I will say is that one point that is promising, at least from the federal government's perspective, is they've stopped talking about welfare and sort of welfare bludgers and all that sort of language that's been in the debate for, let's say, 20, 25 years. And they are talking again about social security, and social security being a safety net. It's a refreshing change of language, and they are trying to change the tone of the conversation, which is really positive. It will be those next steps, as we talked about, in terms of reform. But I think that has been one of the probably better developments in the last, say, 5 or 8 or 9 years, is that sort of really nasty media narrative around sort of welfare bludgers has started to dissipate. And even when we do our media engagement work, we see that the sort of ways that sort of mainstream media want to cover stories around homelessness or community services is changing, because a lot of people are sort of feeling a sort of a resonance with what's going on, and sort of have a much more sort of empathetic approach to poverty and inequality because of just how tough things are. So that is a good sort of overarching sort of changing of tone, but we need greater action.
Yeah. No, that is really positive. Thank you. The other question we have is, I'd be interested to understand that if there are challenges pushing the federal government, what could be done at a state or local council level systematically? And I think, Robert, you touched on this in your kind of critique of the scope for place-based work to counteract the largest systemic drivers. Do either of you have anything to add in answering that question?
I've got a comment, and that is
Please.
that the building of public housing, social housing, needs to happen at a state level. It can't all be done federally. Each time I've been reading about this for a while. Kevin Rudd did some investment in social housing, public housing, and the states dropped theirs. It has to be both. You know, if we've got some investment happening at federal level, not enough, not nearly enough. We've got some investment in some states, but it's not enough. In some states really aren't pulling their weight, and it should be all happening at a state and territory level as well. That's just on housing, one thing that's off the top of my head.
Yeah, look, I just agree with Joanne. That's absolutely right. You know, there's joint Commonwealth and state and territory agreements around sort of housing and homelessness, and it does take that, you know, those levels of government working together much more effectively. I think the national cabinet reform that was sort of brought in COVID is a good one in terms of, you know, moving the federation a little bit more swiftly. But yeah, no, it's a really important point that, you know, we need those levels of government to work together. That's the classic federation problem, right? Is trying to get those to work in sync.
Thank you both. Excellent points. There are okay, great. A new question just popped up from Susan Hazel. We are starting to work on the impact of social determinants of health on animals. It impacts the people, and then they are less able to look after their pets. Do you know of any statistics around animal ownership in relation to socioeconomic status?
It's not something I've looked into. I'm not quite sure. Hopefully someone's collected data on that. I'll have a look while the other questions are coming in.
It's a really interesting question. Look, I'm not aware of any research on that too, but it's great if there's is work or at least thinking being done on that, because yeah, I think that is really important that we're sort of having a really holistic approach like social determinants. But no, I'm not aware of anything either. I mean, it's something that at least when we hear from our grassroots network of people that are relying on income support, they do mention their stress around on taking care of their pets and their animals and how hard that can be, because they're also obviously really important companions as well in some incredibly hard situations.
And I will just add from a food security project that I'm working on, that was one of the findings from around food relief, is that people are also really concerned about finding food for their pets, you know, who can be a source of, you know, incredibly important companionship and struggling lives. So yeah, I do think it is a really important issue to keep on top of. No other questions are coming through, so I wouldn't mind asking you, Robert. I mean, Joe's put together these incredible graphs and incredible statistics. Do you have any reflections from your experience on what helps in advocating to government at whatever level? You know, do the killer statistics help? Do the graphs help? Do the stories about what your community service is seeing help?
Yeah, look, I think it's all of the above is the short answer. Obviously, more and more government are wanting to see the evidence base and the data to help make the case. But I think having the sort of the quantitative data and the qualitative data is really important. I think, at least in our space, when we're doing that advocacy to government, you know, it's fantastic to have the quantitative statistics and sort of the economic evidence, but if you can color and sort of reflect that through qualitative stories of either communities or individual cases, I think that's really important and really strong. One thing I did mention in my remarks when I talked about the Australian Community Sector Survey, it's predominantly quantitative data, but we do have respondents to provide their qualitative feedback as well, you know, their experience in the sector of the last 12 months. This time round, when we collected the data, which was about September last year, a lot of people write about how tough it was for essential workers themselves, and people shared stories about how workers in their services were being made homeless, were having to leave the sector, were working out that they would be higher paid if they worked for Coles or Bunnings or Baker's Delight. And I think when we presented that to the federal government and the respective ministers, that sort of story really was left an imprint in their mind alongside the stats around shortage of funding, length of contracts, being able to have things like that where people are saying I'd be better off working at Coles than I am in the sector, even though I love my job. I think that's the sort of thing that sort of rattles around in their head once you've left the meeting.
Yeah, fantastic. Thank you. And on a similar note, we've got an excellent question from Gemma. Around what vectors do you think are most effective in moderating the rhetoric around underemployment and unemployment in the media? So, do you think that change in dialogue, in tone that you were describing, do you think that's a result of ACOS and the state affiliates kind of work? Is it the kind of the grassroots anti-poverty advocacy from organisations like the Anti-Poverty Network? What do you think has helped shift that framing?
I think the groundwork was definitely laid by those sort of grassroots networks, the ACOSs and SACOSs and others of the world who have been trying to change the narrative for, probably since the Howard era, realistically, and particularly the last few years. And I think that helps sort of lay the groundwork, and things like COVID then happen, or ongoing disasters where people see, they see their neighbours or they see communities just suddenly lose everything. And then you've got, obviously, in the last 12 to 18 months, the cost of living crisis. I think that has helped really catalyze or crystallize in the public's mind that actually people who are experiencing poverty or people who are on income support are not the bad guys. They're not bludgers. They've actually just had an incredibly hard time. I think that's realistically part of it too, is it's so many more Australians now have it tougher. They've experienced disasters, or they've been through floods and fires, or they've had those 3 years of COVID, or they're now grappling with, paying mortgages with rate rises. There's a greater sympathy for what people with the least are going through. It's not the mining boom anymore. Things are much tougher. So I think there's that mindset shift in the public as well, as that actually these people are having it extremely rough, and apart from the grace of God, there go I as well. And I think the sustained narrative from the grassroots organisations during this time has been really important. But I think we saw it particularly in COVID, right? The sense of, well, how are we going to take care of the least, those with the least amongst us, came through into the Australian attitude. So hopefully it is it's a shift that's here to stay, but it has been a constellation of things that's taken sort of a long time to build.
Thank you so much, Robert. We might wrap it up. We've got 5 minutes left, so I might just invite Jo. Do you want to make any concluding remarks before we finish?
Yeah, so I just think we know what can happen. It's just getting that political will to happen, to make it happen. So that Toby mentioned about my activity with PHAA and ARPA at the beginning, and I've gotten into leading and co-writing submissions in the past couple of years, just trying to respond to government consultations, especially related to social determinants of health. And there's been a lot more of those since we've had the new government, and it's just waiting, I suppose, to see whether it leads to something like what Robert said, that there's going to be a lot of recommendations coming out of all these different consultations. But it was a little bit discouraging to see that when they come up with the wellbeing framework, they still didn't really look at the distribution of some of these measures, which, as you've seen in my presentation, is really important. You can't just look at averages. You have to look at what's happening, at the lower end, at the upper end. It's not just about the middle. So how helpful that is.
No, I think that's really good. Sorry, and just to add on to Joanne, it's a lot of this now, is the sustained advocacy. Once the reports are released and the recommendations go forward, and the government's either about to give its response or it does give its responses, it takes, again, this sort of coalition of interested stakeholders to sort of put the pressure on about enacting and implementing the reforms and implementing the recommendations. And the more we can tie it to the government's own language or the government's own way of framing its election commitments and say, well, you've said this, implementing this report as a core part of your election commitments helps to build that pressure. But that's what's been happening in income support, is just sort of trying to chip away for a long period of time. So these reports also give us sort of good leverage points to continue to engage the government and sort of pressure them into doing the right thing.
Fantastic. Well, thank you. That's a great note to end on. I'm sure I speak for everyone in saying that it's been such valuable presentations, and we're really grateful for both of you taking the time to share your knowledge and your work and your expertise. We've learned a lot, I think, and have some hope for a way forward. So thank you both again. This Health Equity Learning Lab Hello webinar series will be back next year. So we'll keep everyone in the loop as we schedule and arrange those throughout next year for hopefully more learning about health equity. So thank you everyone who came, and we'll put up a recording on the website for those who weren't able to make it. So thank you all again. Take care.